Obsessive-compulsive disorder is the fourth most common mental illness, and it can affect anybody: men, women, children, adults, people of all cultures and all races. But what is OCD, and how is it different from normal worrying? With OCD, people have frequent unwanted thoughts, ideas or urges, obsessions, or repetitive behaviors, compulsions, that they feel driven to do in response to the obsession. Obsessions may include a fear of contamination, extreme concern with order, or recurrent unwanted intrusive thoughts of sounds, images, words, or numbers. Compulsions are repetitive, excessive behaviors that occur in response to obsessions. Those behaviors might involve excessive hand washing or cleaning, checking locks and appliances, or approval seeking. OCD is different from typical worry. Someone with OCD may repeat behaviors for over an hour a day to try to prevent or reduce anxiety, distress, or dread. Some will know their behaviors won't reduce the likelihood of the focus of their obsessions. But for someone with OCD, not performing the behaviors can cause even more distress. If you believe that you or a family member has OCD, work with a mental health professional to develop a plan to manage symptoms. The American Psychiatric Association has great resources on OCD. For more, visit www.psychiatry.org.